In this video, we're discussing dental practice benchmarks and actionable tools to evaluate your practice. Often, we are so caught up in the chaos and the busyness of our daily schedule that we just forget to take a step back and to evaluate the progress and all these ways that we can improve. So make sure to watch through to the very end because I'm including 3 free tools that you can implement in your practice day one. These tools include a practice analysis or practice checkup, a source to gain localized UCR fee reports for insurance negotiations, and a hygiene calculator to better plan for expansion and practice management. But first, let's go ahead and dive into 3 major categories to see how your practice compares. Keep in mind that this information is based on United States ideal averages for general private practices, and it may not perfectly describe your specific goals. Our hygiene metrics are up first. Hygienists can roughly see 800 to 1,000 patients on a full-time schedule every 6 months. That's based on a 5-day per week, 8-hour per day work schedule. Hygiene production should be about a third of the total practice production in a general practice, and about a third of those patients that come in should typically have some kind of perio needs. 80% of the hygiene patients should be seen on time instead of overdue. So here's a pro tip that I've worked on with a lot of the customers and clients that I have now, and that's basically scheduling your patients for their recall hygiene appointments before they leave the dental chair, because it gives them 2 different things. One, a standing appointment with your patient, as well as a mark for your front office to go ahead and follow up on several months down the line. Next is doctor production. And typically, about 900 to 1,000 hygiene patients can support a single doctor's production. About 60% should have some form of diagnosed treatment, and 75% of these patients should be scheduled for treatment appointments while they are in the office to increase the chances that this treatment is seen through. Case acceptance is typically, an ideal would be about 70%, and there's some things we'll go over in the future to help increase this number. Doctor schedules should not be booked beyond 3 weeks. Otherwise, it might be worth evaluating just the ability to add a part-time associate or maybe equipping additional operatories, because what happens is often patients become very upset when they can't get a crown for 2 straight months. But if the situation persists, you may want to go and expand or maybe even relocate the practice if this is a consistent topic in the office. Finally, the hourly production is about $350, and let's say if you have more implants or more ortho treatment in the practice, this number will be very different. Next up is our general practice numbers. Each operatory can typically produce about $250,000. Now, I've seen cases where this number can be double or more, so just remember this is an ideal and not a limitation. Collections should be at least 96% of net production. I have also seen instances where collections are actually over 100%, but in those offices, those doctors and the team members are having different conversations with their patients compared to some of the things that I hear in other offices. Very challenging, not always easy, but it can be done. Accounts receivables should not exceed 1 month of the average production, and any AR that you see over 90 days old should be less than 10% of the total AR. Otherwise, you're probably never going to see that money ever. Now on to the 3 actionable tools that we discussed in the beginning. All of these tools can be found in the article linked in the description below, specifically the dentalrocket.com/practice booster. Nowadays, dental offices are fortunate enough to have all these amazing software options that allow us to see the numbers from our cell phones or our tablets pretty much anywhere in the world. But if you haven't upgraded to these softwares yet, we can go ahead and explore some of the manual tools that are available to you. Tool number 1 is the practice analysis or practice checkup. The best way to know your numbers is to pull all these reports and review them frequently. It's so much easier to make small adjustments as the months go by than it is to try to unravel the effects of all these problems a year or more later. So I've also included instructions to pulling every single report from different practice management softwares, and you can find all these resources down in the description below. And always feel free to reach out because we're happy to help interpret these reports since our growth is heavily dependent on the success of our clients. So that's thedentalrocket.com/practice booster. Tool number 2 are the UCR fee analysis reports. So every year you should be negotiating with the insurance companies to increase your reimbursements. And I do understand that not all companies allow for negotiations. However, if you're just accepting the fee schedules they provide you, then there is no incentive for them to increase the payouts. If you're working with us, we can also pull a UCR fee analysis report that are specific to your zip code so that you can go and use that as a tool for negotiation with the insurance companies. Also linked down below in the description. Tool number 3 is our hygiene calculator, which is a great tool that can help when considering hygiene days required to support the current patient base, or the number of patients required to support more hygiene days. Hopefully you found something in this video that was helpful to you. We welcome feedback and questions down in the comments section below. Feel free to head over to thedentalrocket.com to access the many free resources we've put together for dental professionals. I would greatly appreciate you sharing this video with colleagues and friends, as the more people who see this, the greater the chances are we have for helping our dental community. Thank you so much and take care.